Hello, you're welcome back to my channel. In today's video, we'll be discussing about the importance of limit the use of antibiotics. We're going to list three importance of why you should limit the use of antibiotics. But before then, let's clarify ourselves. What is antibiotics? Antibiotic is a medication used to treat bacterial infection. Now we have different types of microorganisms which they categorize into bacterial, fungal, virus. Those medicines that they use to treat bacteria are called the antibiotics. Those ones they use to treat virus are called antivirus, while those ones they use to treat fungi are called antifungal. In this video, we're going to discuss about the reason why you should limit the use of antibiotics. Number one, we have poisonings and reactions. You know, drugs are made from chemicals. 99.9% of all drugs that we're using today come from chemicals. Mixing of chemical, one or two of this chemical in the laboratory to give us a formulation, because if they want to depend on the natural source, which from the herbs, it can somehow be limited. So as a result of this, the drugs which we use are chemical. So when, for example, you are supposed to take 2 milligrams of drugs and you take 4 grams of it, the remaining grams which you added to it become so poisonous to your system. And number two, when you are not sick, for example, nothing happens to you and you just go in there, buy one antibiotics and take, you are actually taking poison. So when you take drugs where you are not sick, you are taking poison. And if you take excess of these antibiotics where you are not sick, you're also consuming poison. What about reactions? Some of those drugs which we take, that's why you have to consult your medical professional before taking any drugs. But some of those drugs you take might not be suitable for your system. So when you take them, you start having 1 or 2 reactions to it. That is why in most of the drugs you see side effects of those drugs. So if you take, there's a limit that will tell you, if you take and the side effect persists for some period of time, you should stop and consult your doctors. So if you take drugs sometime where you are not sick, it can generate some reactions to your system. Number two, resistance to treatment. As a result of frequent use of drugs, you're not sick, you buy drugs, you take, nothing happens to you, just small headache or light headache you have that you need to sleep, to get a chill water or take a bath, sleep and wake up, everything will go. All you could do is to get a very heavy antibiotics just because you think it is necessary for you to take antibiotics. Some people sometimes, even when they have sexual intercourse with a unknown woman, they will rush their adrenaline to buy antibiotics and take. A time shall come that when you need this drug to treat yourself, maybe you have a serious medical condition, your system, this microorganism has developed resistance to this drug. So you keep taking this drug and it will not work for you again. The main reason most of these microorganisms today are developing resistance to drugs. Treatment of bacteria today is more complicated than how it is before. Before, simple antibiotics treat most of these microorganisms, but now most of these bacteria, they have developed resistance to so many of the antibiotics. So when you are not sick, nothing happens to you, don't take antibiotics, because you are doing more harm than good to your system. It's not food. If you are tired sometimes, just get some good food, enough water, rest. That's okay for you. And number three, we have disturbance of natural balance. Like I said in one of my videos, I said we have normal floras in our body system. What are these normal flora? Let's remind ourselves again. Normal flora are those microorganisms which are in our body system, help in producing one or two things to assist in defending the body or assisting the body one way or the other. For example, in our stomach, we have one or two bacteria inside that helps digestion. And also in women, we have what we call lactobacillus that help in producing lactic acid that protect this natural, that is the private part of the woman. That lactobacillus, it helps in reducing or inhibiting a growth of a lot of microorganisms that could be infectious to the woman. So when you engage in taking these antibiotics, most especially broad spectrum antibiotics, it can destroy even this natural normal flora. So when you take antibiotics, it go in there to kill both the infectious and normal flora microorganisms. So when these normal floras are killed, it will, give avenue to one or two microorganisms to start causing infections to your body system. We have drugs. Antibiotics are produced and grouped into three categories based on their function. That one we call broad spectrum. Broad spectrum antibiotics are those antibiotics that work generally to both gram-positive and gram-negative bacteria. That means it kills or inhibits the growth of all bacteria. Number two, we have narrow spectrum. That narrow spectrum antibiotics are those ones that only work for one categories of microorganisms. For example, now narrow spectrum work for only gram-positive, but it will not work for gram-negative. That one that works for gram-negative will not work for gram-positive. And lastly, we have limited spectrum. The limited spectrums are those antibiotics that are produced for only one microorganism. For example, now they produce only one of these antibiotics for syphilis or Staphylococcus aureus. So that is limited spectrum. Most of these antibiotics that kill everything, like broad spectrum, you have to limit use of it. Because when you take it, it goes into the body system, it kills both infectious and normal flora. And when you get rid of the normal flora, your body becomes vulnerable to one or two sickness. So having said that, we have come to the end of our video. If you have not followed me on my social media handle, please do so. And on my YouTube channel, I'm there at your daily health guide, and social media at Shaban Shaibu Omoko. So thank you for watching, and see you in my next video.